Hello, everyone. Thank you so much for joining us this afternoon. I'm Erica Hartquist, Public Health Division Communications Officer with Oregon Health Authority. Today, we are providing an update on the state's continued response to COVID-19, as well as an update on monkeypox, HMPXV, here in Oregon. And joining us today is Dr. Dean Sidelinger, Health Officer and State Epidemiologist, as well as Colt Gill, Director of the Oregon Department of Education. Friendly reminder to please use your mute button for your audio and use the raise your hand function if you'd like to be added to the queue to ask a question. Most of you, I believe, have been granted permission to record one by one, but if you'd like to, we can grant that permission. Just let us know in the chat. We appreciate your patience as we grant you permission to record. And this is, of course, an opportunity for members of the media to ask their questions. The public is always encouraged to ask their questions during our Facebook Live events. So now we're going to kick things off. Let's get started. Dr. Sidelinger.
Thank you, Erica. Good afternoon. I'm Dr. Dean Sidelinger, Health Officer and State Epidemiologist at the Oregon Health Authority. Thank you for joining us for our August update on the state's continued response to COVID-19. Today, I'll be providing information on the state's ongoing measures to safeguard and care for all Oregonians. I also want to provide an update on OHA's and the Oregon Department of Education's efforts to support the health and well-being of hundreds of thousands of Oregon children in our schools for the 2022-2023 school year. First, I want to highlight the generally improving trends we are seeing with the status of COVID-19 in Oregon. Since OHA's last update on July 20th, daily reported case counts have decreased from a rolling 7-day average of 1,406 cases reported July 20th to 852 reported August 16th. This mirrors what the Centers for Disease Control and Prevention, the CDC, is recording nationally. In Oregon, test positivity is down from 13.8% reported the week of July 20th to 11.4% reported the week of August 7th. As we've shared in our regular updates, the number of reported cases does not capture the full story. Many people take at-home tests and the results are not reported to public health, and many others are not testing. What we do know from reported tests and wastewater monitoring is that there are still high levels of COVID-19 transmission in Oregon. On August 11th, the CDC reported that 5 counties, Sherman, Wasco, Umatilla, Wallowa, and Coos counties, were in the CDC's high COVID-19 community level, indicating high levels of COVID-19 and increased stress on hospitals. This is a favorable trend from a month earlier, when 22 counties recorded high levels of COVID-19 and stress on hospitals. Our data continue to indicate that the Omicron subvariant BA.5 remains the predominant strain. OHA continues to work with nearly 40 communities statewide and Oregon State University to monitor COVID-19 transmission through wastewater surveillance. Wastewater monitoring confirms that Oregon saw its last peak in mid-July, and we continue to see general declines in viral concentrations since then. Now I want to highlight some hospitalization numbers. Since our update on July 20th, the number of hospitalized patients with COVID-19 in Oregon steadily declined from a peak of 464. As of today, the number of COVID-19 positive patients in hospitals is 328. The latest forecast from Oregon Health and Science University's modeling team, led by Dr. Peter Graven, published August 5th, reported that the portion of visits to emergency rooms related to symptoms thought to be COVID-19 fell to 4.2% from 6.9% reported July 9th. The model suggests there was a low hospitalization rate from infections, with a significant share of hospitalizations, 56%, projected to be incidental. Overall, COVID-19 positive patients in hospitals and in the ICU remain far below the peaks we saw during the Delta surge a year ago and the initial Omicron surge this past winter. Hospitals are seeing impacts of patients with other diseases and adverse conditions. Patients who had delayed procedures are now having to seek specialized care they need. This is on top of pressures our healthcare workforce has faced from COVID-19 after more than 2.5 years battling the pandemic. In addition, some hospitals are unable to fully discharge some patients who may not need hospital-level care. OHA is in close communication with hospital partners and working with them and also the state legislature on ways to support healthcare systems to address these statewide challenges and remain ready if we see rising numbers. We want to ensure hospital beds are available for any patient requiring urgent care from a possible crash, cardiac incident, or other life-threatening event. Now I'd like to talk about what we can expect this fall with new vaccines and boosters. As you know, the federal government recently announced the purchase of bivalent COVID-19 vaccine boosters from both Pfizer and Moderna for the entire country for possible use this fall and winter, with a total of 171 million bivalent vaccine booster doses to be made available for the fall and beyond. This bivalent booster would be designed to target BA4 and BA5 Omicron subvariants, as well as the original strain. The federal government, including the U.S. Food and Drug Administration and CDC, will update states when the doses may be available. At this time, we do not have a specific date. Meanwhile, our current boosters for the Pfizer and Moderna mRNA vaccines are widely administered and are still working very well to prevent severe disease, hospitalizations, and deaths. Last month, the Nova vaccine was authorized for use as the initial vaccine in adults. This new 2-dose vaccine uses protein technology, which has been used widely for decades and around the world in vaccines for shingles, hepatitis B, and the flu. As of now, everyone 6 months and older is eligible for COVID-19 vaccines. And as of today, nearly 7 in 10 Oregonians are fully vaccinated and more than 4 in 10 are boosted. OHA's message to anyone who is eligible for a booster is simple. If you're eligible, get your booster now and do not wait. Fall is also when we encourage all residents to get seasonal influenza vaccinations. Flu shots are arriving in Oregon right now. Most people begin to get their flu shots in September and October. It's perfectly safe for you to get the flu vaccine at the same time you get your COVID-19 vaccine or booster. You may wish to check when you schedule your appointment to make sure your provider has both. Finally, if you do get COVID-19, remember there are highly effective treatments, including Paxlovid, available to help prevent severe disease in those at greatest risk for complications. You can find out about treatments and therapeutics on OHA's COVID-19 website. OHA strongly encourages anyone who may be at increased risk because of age or underlying health conditions to make a plan for how and where you will get tested and receive treatment in case you get COVID-19. Anyone who doesn't have a healthcare provider can contact their local health center or call 211 for assistance in identifying a provider. Now, I want to talk about the school year. Many of us look forward to the sounds of children filling empty school halls and the happiness that brings. Thank you to all our education and early childhood staff for your dedication, particularly during the past few years, adapting to COVID-19's impact on your schools and classrooms. As a pediatrician and now as a state health officer, I know firsthand that schools are critical to our children's social and emotional well-being. I know they also create opportunities for viruses and illnesses to spread. For parents, getting your children vaccinated against COVID-19 is an easy and safe way to help protect your whole family. COVID-19 vaccines are safe and effective for children 6 months and older. The vaccines were tested over several months and with thousands of children, several races and ethnicities. If you've not already done so, I recommend you start your child's COVID-19 vaccination series as soon as possible. Families may also want to have their children get multiple vaccines at the same time. August is National Immunization Awareness Month, which makes it a good time to talk with your child's healthcare provider about what vaccines your child needs to stay healthy this school year. It is safe and effective for your child to receive a COVID-19 vaccine at the same time they receive other vaccinations. Many families have held off on scheduling well-child visits and recommended vaccinations during the COVID-19 pandemic. It's understandable that parents may have been hesitant to take their child to an appointment. We want parents to know that healthcare providers are taking necessary precautions to prevent the spread of COVID-19. The immunization schedule is designed to provide immunity early in life, before children are likely to be exposed to diseases. Some are serious and potentially life-threatening. Some vaccines also require more than one dose to provide children with the best protection. Each recommended dose is important to gain full protection. This is also important now because vaccine-preventable diseases are still circulating. OHA's Vaccines for Children program offers vaccines at no cost to families who cannot afford to pay for their children's vaccines. Those without health insurance can call 211 to find out how the program can help. You can check the OHA website and search for required shots for school children's facilities to learn what immunizations are required for your child to attend school in Oregon. And now I want to turn the microphone over to Colt Gill, Director of the Oregon Department of Education, to talk about safety and the start of the new school year. Director Gill.
Thank you, Dr. Sidelinger. I'm happy to be here with you all during what I think is an exciting time of year. In most of the state, our students, families, and educators are preparing to return to classrooms. And in some parts of Oregon, students and educators are already back at school. Students and educators are sharing that nervous excitement of reconnecting with one another and looking forward to learning and activities ahead. As we head into the coming school year, we're also holding strong to our North Star goal of providing equitable access to in-person instruction all day, every school day for every student. That's our goal. Last year, we operated with this goal throughout the pandemic. And in partnership with the Oregon Health Authority, we took the necessary precautions and we were able to maintain in-person instruction with very few interruptions in very few schools in Oregon. As the year progressed, we moved more and more to local decision-making based on local COVID-19 conditions. Our local school districts and public health authorities are ready to continue these efforts to preserve in-person instruction this school year. We know that the mitigation efforts work. The vaccinations that Dr. Sidelinger just talked about are crucial. Also, masking at times and ventilation will continue to be key as we adjust to the COVID-19 variants that may come our way, as well as other respiratory illnesses. This year, nearly all health and safety protocols will be locally determined, with district leaders partnering with local public health authorities to make decisions about how to implement health and safety protocols to keep schools open by keeping staff and students healthy. Through the school year, we will also prioritize staff and student physical and mental health and well-being. We will work toward the goals of advancing equity and engaging community, all to provide a well-rounded and inclusive education for each and every one of our students. Care, connection, and community are at the heart of education. Each is essential for ensuring healthy, welcoming communities where students can learn and where staff can teach and nurture our students. To kick off this school year, we are again encouraging schools and school districts to focus on building their community of care and connection at the start of the school year, and then sustaining it throughout the entire school year. This focus is an opportunity for school leaders, staff, students, and families to share and process together the experience of the last couple of school years and foster a sense of hope and strengthen the ties of community that have sustained our schools through the pandemic. We have provided activities and resources to schools across the state to help ensure that this is a welcoming and inclusive year for everyone. To support this year we're adding a dynamic new resource. It's called Oregon Classroom Wise. This is a suite of free print and video resources, guided tutorials, role plays, and interviews with youth and school personnel, all available at the ODE website. This self-guided content for adults and for youth is filled with tools for enhancing mental health and well-being, and it covers many important topics like building safe, healthy relationships, best practices for supporting youth experiencing life challenges and distress, and skills for handling challenging behaviors. Oregon Classroom Wise includes customized learning pathways for community-based organizations, for our educators, for school administrators, for mental health professionals, and even for students and families, and they're designed to address specific needs. By offering youth and adults additional skills for coping with and responding to stressors and strains that most of us are experiencing right now, it is our hope that we can work collectively to enhance community well-being and resilience and reduce the incidence of emotional and social and behavioral challenges so our students can concentrate on learning and our educators can concentrate on teaching. We're working with schools across Oregon to make this, again, a great school year. A school year that is open to in-person instruction once again, welcoming and inclusive, supportive and healing, and focused on delivering that well-rounded education that allows our students to thrive and reach their dreams. Thanks. Back to you, Dr. Sidelinger.
Thank you, Director Gill. I want to change topics for a moment. With OHA's announcement today of the first pediatric monkeypox, or HMPXV case in Oregon, many families may be wondering, what does this mean for schools? Let me reassure you, school settings present low risk for transmission of monkeypox. As we continue to face this outbreak, we will have students, staff, or teachers who are diagnosed with monkeypox. We encourage them to stay home if they're sick or develop a new rash. Seek care for testing and treatment. This will help minimize potential exposures, even exposures that present low risk for transmission in schools. We are asking schools to plan now for how they will support staff and students who may have prolonged times isolating at home while they recover. Schools should plan for how they will protect confidentiality of school community members who are sick and address monkeypox in a non-stigmatizing manner. Anyone with prolonged skin-to-skin contact with an individual with monkeypox can get monkeypox. Right now, the disease is spreading primarily in gay, bisexual, or queer men who report recent sexual activity with other men, and that is where we are focusing our prevention and response efforts. Now, I want to thank everyone in Oregon who continues to care for each other and their neighbors. All of us can still take simple steps to look after our fellow Oregonians, especially as school starts. Along with being up to date with vaccinations, each of us can still wear well-fitting masks in indoor settings. For those at high risk or those who care for or live with someone at high risk, wearing a mask in indoor public places offers extra protection. Wearing a mask in areas of the state seeing higher COVID-19 transmission also provides protections to others around you. And with that, I'll turn it over to Erica and open it up to questions from reporters.
Thank you very much. All right, well, we have no one with their hand raised, so just a friendly reminder to please raise your hand and I will call on you. I'll add you to the queue and we'll get your question answered. So, okay, here we go. First one, OPB, Amelia Templeton. Go ahead, Amelia.
Yeah, hi. Can you clarify the pediatric case, the age class of that case, if it's an infant, a child, or an adolescent?
Right now, all I can confirm is that this is a pediatric case, so someone below the age of 18.
Is there a reason why other states have released more helpful information, at least regarding the age range of a case? Why not do that? What's the
At OHA and my public health colleagues at the local and tribal level really do value our responsibility to protect the privacy of individuals. So we're releasing the minimum amount of information we can to help protect these individuals' privacy and their identity. If releasing the age or anything else about the patient would help to inform certain subsets of the community to take additional steps, we would do that. But this shouldn't, the age of the child doesn't impact, increase the risk to anyone in the state. So we're keeping it broad and listing it as a child, and know that the risk of spread amongst children is low, comes from the behaviors we discussed: prolonged skin-to-skin contact with the lesions of someone with monkeypox. Primarily during this outbreak, this has been during intimate or sexual contact among men who had sex with men. It can also be seen in caregiving, from a parent to a child, from an adult to another adult, or in some cases in household settings where it can be transmitted during prolonged close contact. So with this, we know that we have a child. This child's case is linked to another case here in Oregon, and that's all we have for now.
Can you, was the child given access to vaccination prior to becoming symptomatic?
This child was became known to public health at the time of their testing, and appropriate follow-up was done from our public health and healthcare partners.
Thank you, Amelia. All right, our next question comes from Liz Birch with Coin6. Go ahead, Liz.
Hello, and thank you for your time today. My question is for Dr. Sidelinger as well regarding pediatric case of monkeypox. I know you touched on this case, but if you could talk a little bit about, will there be any strategies, any protocols put in place to slow the spread of monkeypox in schools once kids are back in school?
Thank you. Right now, I don't think there's extra measures that we need to take to put in place in schools to slow the spread. This disease does not spread like COVID-19 or other diseases we worry about spreading in schools, like chickenpox, that can spread easily through the air and infect multiple people in a classroom or a specific setting. In the case of monkeypox or MPXV, an individual needs to be sick to transmit the virus to others. The primary transmission comes from contact with those skin lesions and often over prolonged skin-to-skin contact. This is why we're asking and reinforcing the message that we give every school year, that parents should keep children home if they're sick, particularly if they develop a new rash. Seek care, talk to their provider about those symptoms. Adults, staff, teachers, and others in that setting should do the same. If an individual who is later diagnosed with monkeypox has attended school, we will assess that individual's situation. Did they have lesions at the time they were in school? Were those lesions covered? Who were they around? What kind of contact did they have? In general, being in a classroom, being in a hallway, eating lunch at a table with someone with monkeypox would not put that person at significant risk. But public health will work with school nurses and others in the school community to assess who might have been potentially exposed and offer appropriate follow-up as needed. Other than routine cleaning and the focus on educating families about keeping sick children home, having sick staff stay home, planning for how to support any school community member who may have to isolate at home for a long period of time, and addressing monkeypox in a non-stigmatizing manner, protecting the privacy of individuals if and when they should be diagnosed, is what we're working with schools right now. But special precautions about preventing the spread do not need to be taken because what schools have in place are already very low risk.
Dr. Sidelinger, can I add a little bit to that?
Yes.
I just want to make sure you're all aware that as we created the guidance for this school year, we really leaned into existing requirements for all school districts and now schools to have communicable disease plans. These go well beyond COVID-19. They help serve schools for other communicable diseases that are respiratory or like monkeypox that the questions are focusing on so far today. So this information is available for schools. They have existing, especially since what we've experienced the last 2 years, strong relationships with their local public health authorities. So they will be connecting about cases if and when they arise in a school setting, and they'll take the precautions that Dr. Sidelinger talked about. We will also be providing a set of materials to school that focus on communication and informational materials that help reduce the stigma that is now associated with monkeypox to some degree. So we will prepare our schools to be able to communicate about this effectively within the school community and to help ensure student and staff and individual privacy.
Great, thank you for that question. Our next question comes from Mike with KEZI. Go ahead, Mike.
Hi, thank you so much for hosting this press conference. I have a question just about OHA's pandemic response so far. Earlier today, the CDC director announced plans to make some reforms, citing issues with some of the pandemic response, including confusing guidelines and sometimes overwhelming guidelines. Being that OHA follows the CDC pretty closely, are there any plans to review what the CDC comes up with and make any changes for the future?
Thank you for that question. Certainly, OHA, along with our local and tribal public health partners in the state, look forward to what comes out of the CDC review and updated guidance or procedures for developing guidance. All of us in public health, all of us in healthcare have learned a tremendous amount from this ongoing pandemic and how to address it, how to communicate about it, how to develop guidance. It's been more than 2.5 years that we've been battling this virus. We've learned information about how it spreads, how it doesn't spread. We've gotten new tools from intravenous medications, injectable medications to now oral medications. We have multiple safe and effective vaccines that are now available for just about every individual. OHA, like the CDC, strives to use the best evidence and the most recent data to issue guidance to individuals so that they can take steps to protect themselves, loved ones, and broader community. As we learn additional information, it can sometimes be hard to kind of integrate that into new guidance and change recommendations fairly quickly. And during the COVID-19 pandemic, that had to be done multiple times. So I think the CDC is really looking at are there places where that process could be streamlined, that more timely information could be given out, even if all of the information that we would normally use to make a decision in a non-pandemic time isn't there. And OHA continues to do the same. We tend to evolve our guidance in similar cycles to the CDC. As new data comes in, new research is released, we will update our guidance. Sometimes we're a little ahead of the CDC. Oftentimes we're right in stride with the CDC, and sometimes we lag a little behind based on the conditions on the ground. So I look forward to this change. And in OHA, we are doing similar things. How can we best respond to what's in front of us with the data we have? And we'll continue to refine that process.
Thank you for that question, Mike. Our next question comes from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hi, thank you. Just several questions. One, has OHA started, have providers started applying subcutaneous doses of the vaccine, five per dose?
Thank you for that. The FDA last week authorized the use of the Jynneos vaccine against orthopox, which we are currently using in the current monkeypox outbreak, to be given intradermally, meaning just under the skin surface. We have released guidance to our partners, and some partners are starting to use intradermal dosing to deliver more vaccines per vial. And that research shows similar levels of antibody response after 2 doses. So those have started here in Oregon. Not all providers have switched over to that. Some of that is based on supplies and ensuring they have vaccinators with the right skills to do that.
Thank you. Another question. So have any educators contracted monkeypox, and if so, how many?
I don't know the occupation of our cases, so I can't answer that.
Sorry. You cannot answer whether any educators, any school employees in Oregon have have monkeypox. Is that correct?
I don't have the occupation of our patients. I don't have access to that information, so I can't answer that.
So if you mentioned that part of the takeaway for parents should be that they should not be concerned about the spread of monkeypox in schools, but how can you provide them with that confidence if OHA doesn't know whether or not the adults that children interact with may have monkeypox?
Because we have a significant body of knowledge about how monkeypox spreads during this outbreak and previous outbreaks. Direct skin-to-skin contact, usually over time with lesions of an individual with monkeypox, is how we're seeing spread. In this outbreak, currently the social groups and the communities that are most impacted are men who have sex with men, queer, gay, bisexual men, and it's through intimate and sexual contact that primary transmissions have occurred. Other transmissions that we've seen across the United States have been through this type of prolonged contact, and these types of contact do not typically happen at school. So the environments and the types of activities that happen at school present very low risk for transmission of monkeypox. And we hope that individuals who have symptoms of the disease seek care and don't attend school, and that'll lower the risk even more.
Thank you. And then last time we talked, you mentioned that CDC will be coming out with models that would potentially have state level modeling for the potential course of this outbreak. Does OHA currently have models? And if so, what do they show?
We don't yet have models that look at what is the kind of potential near-term forecast for cases and spread of monkeypox, either at the national level or at the state, but our CDC partners are still working on this.
Thank you very much.
Thank you, Fedor. Our next question comes from Brett Taylor with KDRV, Southern Oregon. Go ahead, Brett.
Thank you guys for hosting this meeting. My question for you is, obviously over the last couple of years of the pandemic, we've kind of seen a continuous spike in cases, especially as we've had closer and closer to the winter months. Obviously last winter season, basically in January, the Omicron variant, obviously having the state see numbers of cases that were never seen before. Even though vaccinations are up, the fact of the matter is that with this virus, we still don't know what the future, holds ahead of us. So in regards to schools, I know that local control has been given more to them, but if the situation were to somehow get worse than what we saw with Omicron, would ODE or OHA take back of that control and put more of those regulations from a state perspective? Or at this point in the pandemic, is local control going to be the way that schools move forward, even if we see another huge surge of hospitalizations cases within counties again here in Oregon?
Thank you for that question. I'll start with some comments and then turn it over to my colleague, Director Gill. I think, we need to be humble when we talk about COVID-19 and how it may change in the future. New variants are appearing, with regular frequency. And what are the characteristics of those variants we can't predict in advance. Some have been much more contagious, like our Omicron variants, the various subvariants we've seen of Omicron, but they have not led to more significant disease in people who get it. Other variants have been more transmissible and led to more severe disease, like our Delta variant. The good news is that the vaccines we currently have available, if people stay up to date with the recommended doses, are keeping people out of the hospital, keeping people from having severe disease, and keeping people from dying. We are looking forward to reviewing the data on bivalent vaccines, or vaccines that will help protect against specifically Omicron as well as the original variant, and seeing how effective those are, and using those in the fall to offer people an additional layer of protection. Right now, individuals 6 months and older, so parents of children and parents, have the tools in front of them to help prevent severe disease, getting the recommended number of doses of vaccine. In addition, keeping children home, staying home yourself if you're sick is another way of keeping the illness from spreading. If you have symptoms of COVID-19 and you have accessibility to a test, doing a test a couple days after you develop symptoms, repeating that test if it's negative can help determine how long you need to stay home to protect yourself and others. Not everyone with COVID-19 has symptoms, so some people may attend school. People who want to continue wearing masks, particularly in communities that have higher levels of spread, should be supported in doing so. Individuals who are at higher risk for complications, if you have an underlying condition, you're older, or you live in a home or care for someone who is, should continue to wear a mask in public places. I know I do. We know that not everyone will wear a mask, but local leaders, if they're noticing increasing cases in their community, or seeing increased absences that are associated with symptoms of COVID-19 or increased diagnosis of COVID-19, may choose to recommend that everyone in school settings wear masks for short periods of time to cut down on the spread. At this time, we are leaving those decisions to those local school leaders who can base their decisions based on what's happening in individual classrooms, grade levels, schools, or across a district. They know the data, they know the resources that they have, they know the improvements they've made in ventilation, they know their vaccination rates, or can look at vaccination rates in their community and other things that they can use to make those decisions. Certainly, if the virus evolves and we see variants that are causing more significant disease, particularly affecting children, or that our vaccine or more severe variants that are causing more severe disease, particularly in children, or our vaccines are not offering the level of protection, we will discuss what are our options. Do we need to look at more measures? Do we need to recommend something more strongly, or do we need to consider statewide actions? But right now, we have nothing on the horizon, no indications that we're going to see the virus mutate in a way that would cause us to do that. But we continue to meet regularly, ODE and OHA, discuss what's going on. But right now, we think our approach that served us well through most of last year to lead this decision at the local level, responding to conditions, will be how we get through the 2022-2023 year. Director Gill.
Thanks, Dr. Sidelinger. I think you covered it really well. I would just stress that, Oregon schools, except for just a very few outliers that needed to close for a day or two or three, stayed open through the Omicron surge. They did well. They used mitigation strategies. Some went back to universal masking. All of them emphasized vaccination. They worked on ventilation controls. They have access to testing. They'll continue to have those tools this year. So through those kinds of variants and surges, I'm really confident in our local school leadership and our local public health authority leadership to manage and help maintain in-person instruction for our students. We think that's really important. It's what they need right now, that connection with community and that access to a well-rounded education. And just like Dr. Sidelinger said, we're going to be watching all the data carefully, the variants that come forward. And if there is a variant that comes forward with, severity in terms of the illness that it brings, and becomes highly contagious like Omicron, then we will, coordinate and work with all of our partners to determine whether any statewide action is needed.
Thank you for that question. Our next question comes from Kevin with the Mail Tribune. Go ahead, Kevin.
Oh, yeah. Thank you very much all for doing this news conference. I think you held a couple of them before. This is my first rodeo, and it's going well so far. I just wanted kind of an overall sense, it occurred to me, I guess, since the pandemic really came into full bloom in March of 2020 or so, this is the first school year we're starting without masks and a lot of the heavy cloud of the pandemic and infections. So maybe this is particularly a question to Mr. Gill. Does it strike you that this is the first year in a while starting without masks and everything? And what could that mean for the students' social and emotional well-being?
Yeah, thanks for the question. I think that the impacts of the pandemic overall, whether for some individuals, masking was a part of that, or for many others who had family members who became ill, or friends and family members who didn't make it through COVID-19, the impacts have been strong. We have evidence that is coming into us through surveys about the impacts on our students' social emotional well-being. We also have been in Oregon very much focused on providing an integrated model of mental health resources to our school districts to support students and educators. So we've provided mental health toolkits. We've had the Care and Connection campaign and program in place last school year and this school year, and have now added to it with the Oregon Classroom Wise activities and resources that we think will be really valuable. We do think that we need to make sure that we're constantly addressing and paying attention to and supporting our students and our staff members, and frankly, their families as well, with strong social, emotional, and mental health supports, so that schools can do the business of schools, which is ensuring our students are served equitably, that they're there, that they're healthy, and that they're able to access their education. So that'll be the goals this year. And I know that in districts around the state, as I've met with superintendents throughout the summer, they're excited to start a school year off in a way that feels something more like it did prior to COVID. And they're also preparing each of their schools with plans to respond to COVID or other communicable diseases as needed. Those plans, by the way, are posted on each school district's website prior to the start of school, so that families and community members can go in and take a look at those plans and make sure that they understand them well and know how their school is ready to care for the students during the school day.
Thank you for that question, Kevin. And if you have any additional questions, I know you're having trouble with the feature, the raise your hand feature, you can just post them in the chat and I'll ask our experts today. Next question, Elizabeth Miller, OPB. Go ahead, Elizabeth.
Thanks, Erica. I just have a couple of quick questions. You know, good ventilation has been cited as one of the mitigation strategies to prevent COVID-19. Are there any requirements or guidelines from ODE for schools to do this? I mean, I think about some schools that might not be able to open their windows or something like that. So what's the recommendation there? And then just quickly, are there any conversations about requiring COVID vaccination for children in Oregon? Thank you.
Thanks, Elizabeth. I'll start and then I'll ask Dean or Dr. Sidelinger, excuse me, to take over, especially on the second question there. So we have published guidelines, as has the CDC, on recommended ventilation supports for schools and for buildings that house a lot of people. So those are available to all of our school districts. There is still available through September of 2024 federal COVID relief dollars that go specifically to schools. So through the American Rescue Plan effort, those COVID relief dollars for schools totaled a little bit more than $1 billion. And schools are still using those funds to continue to upgrade ventilation systems, whether that's replacing filters or seeking alternative ventilation where there are classrooms that don't have windows or other ways to readily circulate the air. So I do think that through this summer, we saw quite a bit of activity in our schools to continue to upgrade those systems and to make sure that the proper filtration and airflow is in place. It is a locally determined effort, though. So the guidelines are available on the ODE website for the schools, and they were created in collaboration with the Oregon Health Authority and following CDC guidance. But it is the local determination of each school district on exactly what enhancements they'll make to their systems.
Thank you, Director Gill. I will say, this is why we talk about layered mitigation strategies. Different schools are able to implement different levels of changes in ventilation. And with highly transmissible variants, like some of the Omicron subvariants we've seen, that alone, won't provide complete protection. So working with parents to encourage vaccinations for children, providing easier opportunities for staff and students to get vaccinated, supporting individuals' use of masks, particularly when spread is high, or at times thinking about more strongly recommending that everyone wear masks if they're seeing spread of COVID-19. Layering things together can help provide additional protection. As far as requiring COVID-19 vaccinations for students, I don't see that coming during this coming school year or anytime soon. At OHA, we have a regular process that existed before COVID-19 for reviewing vaccinations, the impact of illnesses on schools, and an independent group that comes through and makes recommendations to OHA about whether or not an approved vaccine should be recommended to be added to the school immunization schedule. Right now, we have approved COVID-19 vaccines for some children, but not all, with younger children receiving vaccines that are authorized under emergency use from the FDA and recommended by our CDC partners. We'll continue to review the effectiveness of our vaccines and the impact on schools, but I don't see any recommendation for school vaccination requirements for COVID-19 coming anytime soon in Oregon.
Thank you for those questions, Elizabeth. All right, our next question comes from Noah Chast with KTVZ in Central Oregon. Go ahead, Noah.
Thank you. My question is in regards to the CDC guidelines that have been peeled back. I know some of them are having to do with not having to quarantine if exposed but not infected, no longer doing 6 feet in terms of social distance, and also not contact tracing if you're not a medical organization. Are those sort of peel back something that both the OHA and the ONE are recommending for school years this year?
Thank you for that question. I'll start. Based on what we were seeing last spring of circulating virus, in our communities and impacts on schools, and trying to plan ahead for the fall, where we currently almost are, school year in 2022-2023. In April, ODE, in collaboration with OHA, released updated guidance for schools. And the new CDC guidance really does come into alignment with that guidance that we issued to schools. In the spring of this year, we peeled back contact tracing and case investigation universally, peeled back our recommendation for quarantine outside of some healthcare settings and some other specialized settings, knowing how quickly and broadly the Omicron subvariants were spreading and how much disease was causing. So the CDC guidance right now is very much in line with the ODE and OHA guidance that was released in the spring. There are a few places where there are small differences that we have just based on local conditions, but we are not quarantining students or staff in schools. We are not doing active contact tracing, in schools, or requiring the same level of reporting. Our schools still have access to on-site testing for diagnostic testing, screening testing in some instances, and other testing resources that they can use as they respond to it. And that's also in alignment with the CDC. Director Gill, is there anything you want to add about CDC alignment?
Yeah, thank you, Dr. Sidelinger. The only thing that I want to add is to be really clear that, like Dr. Sidelinger said, we are in alignment with the new CDC changes in relation to changes we made last spring for our school districts. But even more so to remember at the local level that each school district will be creating the mitigation protocols locally. So in most cases, they will follow the CDC guidance and what we have on our websites available to them, but they may make other decisions that are through collaboration with their local public health authority, in collaboration with community and staff. You may see some school districts that relax certain mitigation efforts in some areas and increase or emphasize others in other areas. And those may change from time to time as we see different variants come and go from different communities in Oregon. The CDC has a tool available for school districts that gives them what's called CDC community transmission levels. So our school districts will use those to understand when their community might be under higher levels of COVID-19 transmission, and they may make changes to their local protocols based on that. So I think it's really important just to recognize that while our guidance is largely in alignment with the CDC guidance, each school district may implement a little bit differently because they have that local decision-making authority to do so. And I would also just emphasize, in relation to a required quarantine of some kind, that it's really important that students and staff members, volunteers in schools, all those folks, that if you believe you have symptoms that are something like COVID-19, that at least until you get that test and know for sure that you assume that that's what it is and you don't go back to school, that you stay home if you're sick. That will help keep everyone else in that community safe and help keep that school open and serving those students in that community.
Thank you for your question, Noah. Okay, follow-up questions. We have Fedor Zarkin. Go ahead, Fedor.
Thank you for taking my follow-ups. So how many monkeypox vaccine doses does the OHA currently have in stock?
I'll take it back to Fedor. The vast majority of the vaccines as they come in are distributed to our local partners, community-based organizations, local public health authorities, and healthcare partners. Last week we were down to under 30 vaccines or 30 vials that we had in stock. We're currently eligible to receive our next shipment of vaccines, and I'm not sure if they've arrived yet in the state or where they are in the status of being distributed to our local partners.
Thank you. And what are OHA's current estimates as to the actual prevalence of monkeypox in Oregon? As in, there's a certain number of confirmed cases. What is the ratio of confirmed to estimated actual?
Yeah, I don't have a definitive estimate. I would feel confident saying that the 116 cases that we have reported to us are likely an undercount. We're doing our best to reach out to, get the message out broadly about what are the symptoms of monkeypox, what are the behaviors, and who are the social groups and communities that may be at higher risk, so that people can take actions to seek care if they develop those symptoms. We continue to work with our healthcare partners about early identification of monkeypox. The rash can be subtle. The rash may not be kind of covering the face or the limbs, as we've seen in some earlier pictures. And so asking questions about symptoms is important so we can get more people tested. It is an undercount, but how much of an undercount, I don't know for sure. And I haven't seen great estimates of that in other states or communities either.
Okay, so with the COVID pandemic, we've seen several periods of time where it was known that the reported cases were substantial undercounts, say early on when testing wasn't available, or more recently when at-home tests became available. So with this current outbreak, would it behoove OHA to provide estimates of potential actual prevalence to back up the assertions that the general public should not be concerned?
I think, we look at the data we have. So we have data on the reported cases. We have data on how, which of those cases, what kind of risk behaviors they had beforehand and how they likely got it. We look, as we identify people they had contact with, reach out to them about potentially offering vaccine if they had intermediate or higher risk contact with the individual to get them vaccinated, and then we can follow them. We're not seeing significant spread, from the individual with reported cases to others. And so, it is an undercount, but, this is not something that's spreading extremely rampantly across Oregon in folks who are not having, prolonged skin-to-skin contact, whether intimate or sexual contact, caregiving, or household contact with individuals with active lesions of monkeypox. So yes, it is an undercount. How much of a degree, I can't say, but this the average Oregonian should not have the same concern about getting monkeypox as they would about getting a respiratory disease like COVID-19, which can be spread easily, in indoor public settings, and has a much higher, infectivity rate than the orthopox virus that causes monkeypox does.
Can you say if the current numbers are an undercount by dozens, hundreds, or thousands of cases?
I cannot say. I can just say that it is an undercount.
So even in those broad categories, that is also not something that OHA can say.
All I have is data to say that we believe it's an undercount, but I don't have data that would give me an estimate of how much that undercount is.
Okay, thank you.
Thanks for the questions, Fedor. And feel free, everyone, to email me for any follow-ups that you might have, because we are approaching the 2 o'clock hour and we want to make sure we get to our final question, which comes from OPB again. Go ahead, Amelia.
Yeah, hi. Do you have the equivalent of an epi curve for monkeypox in Oregon? And do you have any measure that shows whether vaccination and prevention strategies are curbing spread yet?
I don't have a specific epi curve in front of me. Certainly, we as we get more cases and update our website, we can post that data. What we're still seeing is an increase in reported cases. So we're not seeing a curve where cases have come up, leveled off, and come down. We're seeing increases in reported cases week over week. So we're still in the growth phase of this outbreak. We do ask individuals when they're diagnosed with MPXV about history of vaccination with the Jynneos vaccine or previous smallpox vaccines. And we don't have a significant amount of data right now, but we are going to we do share that information with our CDC colleagues so it can be put together with data from other states so that we can see in the broader population how effective the vaccine strategy with post-exposure prophylaxis has been. But right now, with the small number of cases, I don't have that kind of data compiled, but we are providing that to our federal colleagues because put together with other states, it will give us a better picture of spread.
And then I have a prevention question related to household transmission. We mostly haven't talked about household transmission because the statement has been it's been pretty rare. I think with the announcement of a pediatric case, people will be thinking more about the potential for household transmission. What would you say to parents, who need to take care of their children, which includes physical contact? How can a household with monkeypox try to reduce transmission risk for its most vulnerable members, like kids?
Certainly, and I think the Centers for Disease Control has some guidance on isolating at home and steps you can take to protect other members of the household. And OHA, I believe, has links to that from our website and is in the process of updating our isolation guidance to give people practical tips. As much as possible, an individual with monkeypox should isolate away from others, in the home. If they have, another relative or a caretaker who can help care for kids, that can limit the amount of time that they have to spend with that child. Younger children, infants who may be breastfeeding, that's not as possible. So individuals can take steps to cover lesions that they have with an ointment like a petrolatum ointment and a bandage, use clothing to cover that so that if they do need to have contact with a child, with another individual that they're providing care for, that they can lower the risk of transmission. Clothing that has been in contact with lesions or bedding that has been in contact with lesions should be handled carefully. If the individual themselves can wash that and not have someone else do it, or if the other individual can handle that with gloves, that can reduce the spread. For people who are going to spend a prolonged period of time in an enclosed space with someone, even though airborne transmission is very rare, what we've seen, particularly in individuals who may have lesions around their mouth, if they have that prolonged face-to-face contact and conversations, could potentially spread the virus. So an individual who is sick with monkeypox in the home could wear a surgical mask or barrier protection to help protect those around them. And if others wear a mask as well, that can increase protection. So there's multiple steps people can take to reduce their risk. We have those on the CDC website, and we will want to do that as well. So Eric, is that the last question, Amelia, or do you have another?
That is my last question.
Okay, thank you.
We have one final question. Comes from Fedor. Another question from Fedor. Go ahead.
Thank you. What are the conversations OHA is having regarding the mask mandate in healthcare settings, and whether that's potentially going to be a permanent requirement or what the timeline might be for removing it?
Thank you for that. We currently, per our Oregon Health Authority rule, have a rule in place for requiring masks in healthcare settings. We know that these are settings where individuals with COVID seek care. Individuals who are seeking care for other reasons may have COVID. And some of our most vulnerable Oregonians with chronic conditions, underlying conditions, seek care. Our healthcare staff are exposed at a routine basis at work to COVID-19. So we recommend that they be up to date with vaccines to offer them protection. But those masks, universal masking of all individuals in those settings, can help prevent spread of COVID-19 in those settings, help protect the workforce so that they're there to provide care for us, and help to provide a level of safety to the patients in those settings.
Is OHA considering, allowing providers to make local decisions, depending on the kind of healthcare that they provide, where they might think that they are at less risk and should make that decision themselves?
At this time, we're not anticipating changes in the healthcare mask rule. We anticipate that it'll stay where it is for now, as we currently still have high levels of COVID-19 spreading throughout Oregon. And we anticipate that that may increase in the fall as immunity wanes from those who've recovered from Omicron infections.
Thank you very much.
Well, I want to thank all of you today, and really want to thank Oregonians for their continued support and partnership in fighting COVID-19. We've all made sacrifices, some tremendous sacrifices, losing loved ones or multiple loved ones, caring for individuals as they recovered from COVID-19, or caring for individuals who are still suffering from symptoms long after their acute illness. Many individuals are suffering from those long-term symptoms and have been unable to return to work or some of the activities that they loved. You know, it's interrupted our ability to celebrate milestones, to mourn and grieve deaths, the loss of loved ones, whether to COVID-19 or others. We know this had a tremendous impact on students, teachers, and families as schools had moved to remote learning and then had disruptions in learning and changes in learning throughout the pandemic. That connection to talented teachers, the staff and supports that come along with in-person instruction are extremely important, and has been the North Star for ODE and OHA as we've worked together to keep students safely in in-person instruction with minimal disruptions. We hope that will continue the success we saw during the last school year with kind of smaller impacts on particular classrooms or schools and not the broad impact we've seen. We know that the anxiety that some people still face in being worried about getting COVID-19 because of their underlying conditions is huge. We know that that anxiety can be even heightened because we're talking about a new infection, monkeypox or HMPXV. This is a disease that spreads much differently, is much harder to get, and is spread from person to person when they have symptoms. So if you get sick, if you develop a new rash, call your healthcare provider or seek out a healthcare provider and let them know of your symptoms so you can get the care that you need and protect those around you. You know, this has been a tough time, but Oregonians have come together. We stayed home to save lives early in the pandemic. We wore masks, and many of us continue to wear masks in indoor public settings that may put ourselves or our loved ones at risk. We've gotten vaccinated, we've rolled up our sleeves, and now we have younger kids, rolling up their pant legs to get their vaccines. We still have work to do on getting more people boosted, more people vaccinated, but we've come together, we've saved lives, we've made an impact, and we can move forward to address the disease with the tools we have in front of us. Enjoy the remainder of the Oregon summer. Stay safe in the heat, find a cooling location